There's been some wonderful things that have happened in addition to the process of creating a healthcare reform plan. Of course, I am deeply involved in the creation of the welfare reform revolution as well. One of them is that I finally made the New Yorker. My mother, who lives in Cleveland, considers making a New Yorker cartoon the high point of my career. About 6 months ago, there was a cartoon in the New Yorker, and it was a little boy and a little girl, and the little boy had a medical bag. And the little girl said to the little boy, "You be the doctor, I'll be the secretary of HHS." We have gotten bogged down in Washington in the details of health care reform, and we're going to talk a little about some of those details, I hope, on the panel, and I'm not going to speak too long to you tonight because I want an opportunity to answer your questions, and since I'm going to try to take the red eye tonight, and we have some very distinguished panel members, I want to leave time for that. But in the process of developing the health care plan, we did think some about the overarching questions that should guide our decisions. Throughout modern history, organized religion has made it very clear that a person's physical health is an integral part of their spiritual health. And throughout American history, a number of religious organizations have stepped forward to create very caring institutions to protect the health of our people. Health care and the ongoing national debate over how to reform the American health care system is a clear example of the need, I think, for thoughtful discussion and reflection. And in many ways, as the health care reform plan has moved from the administration to the Hill, we've had a chance to sit back, and we are now moving around the country more happily, I should tell you, talking more about the fundamental principles and what we were thinking about and the kind of values that we brought to our own internal debate over health care reform. A lot of the current debate is now filled with partisan rhetoric, with mudslinging, and with a lot of unsubstantiated accusations, and I spend a lot of time in health care reforms just trying to answer factual questions about what's going on. But tonight I thought I'd step back a little bit and spend some time answering some of the more fundamental questions that have led so many of us to spend our time thinking through the health care reform directions the country might go in. When we began to look at health care reform in the administration, we actually did try to examine all aspects of the health care system, various kinds of approaches to resolving the problems that plague not only the health care institutions and the people that deliver health care, but the American people themselves in terms of what their own needs were. We were determined then, and we're determined now, to try to preserve those things that work well and try to fix those things that don't. And we actually don't see what we're doing as very radical, though obviously those in the system think of it as much more significant change than they've been part of, at least for many people. As part of that process, we really did have some conversations with ethicists early on, very early on in the administration, and in fact there actually was a conversation, a dialogue between the President and the senior members of the Cabinet and a group of ethicists early on in the health care debate. We asked people for their advice, and I think in many ways their advice was invaluable. In particular, we asked what they thought was wrong with the existing system, and I think that some of the advice certainly guided our experts as they worked through some of the policy issues. Too often, of course, as you would expect, people said to us, the healthcare system violates, our healthcare system violates the basic principles of equality, of justice, of liberty, and of community. And that's a pretty sweeping indictment. I'm not suggesting in that we don't have a healthcare system in the United States of the highest quality, or professionals who work in it that are of the highest quality, but that some of the basic principles that we care about as a people and as a country simply are not applied across the entire system.